So you're saying the experience I was witnessing where the chiropractor was adjusting someone, that could have been legit in terms of the therapy, meaning if someone was sitting on a terrible chair all week, every week, they come in Friday for their headache adjustment, the headache goes away for the weekend, then they're back next week for the headache. You're saying, yeah, legitly that could have been a structural postural thing that he was addressing. But then at the end of the day, maybe it was the diet piece, like I mentioned, even just simply getting a lot of these patients off gluten. They noticed that they only had to come in every 2 weeks or every 3 weeks. So is it, would you then say that the food allergens were contributing to increased inflammation, maybe triggering these nerves to be more sensitive? Or what do you think the diet, how would that link into the structural component?
Yeah. So the diet does two things, right? The diet, one, increases an environment of inflammation. The more inflamed you get, the least amount of blood flow, less blood flow you get to the muscles, less blood flow you get to the nerves. So there's going to be less communication, right? It's like you're on a microphone and you start to get near static, right? And you start getting static. It's kind of like that. So if we have a lot of inflammation, what starts to happen is the muscles start becoming less pliable, more like beef jerky versus soft and supple. And then that affects the nerves as well, because the more inflammation there is, that's going to affect nerve communication. And then, of course, the more inflammation there is, and if we have bad posture and we don't move, then the joints can become a little bit stuck and maybe out of aligned or subluxated. So it could aid to the inflammation, which then makes it harder for the muscles to work, thus harder for the joints to work and the nerves to work. That's number one. And then number two, things like gluten have shown to actually decrease blood flow to the brain, to the frontal cortex. So you have blood flow up the garden hoses on the side of your neck called the carotid artery. And there's studies on this talking about gluten decreasing blood flow and creating inflammation in the brain. So one, it's going to do it via structural mechanisms of the nerves and muscles and joints from an inflammation standpoint. Structural two, it's going to affect blood flow and drive up inflammation to the brain, which then can create more neurological activation, immune activation in the brain, which can create symptoms of head pain there too.
So if you want to be smarter and make better decisions, make sure you're not eating gluten. That sounds pretty convincing to me. Also, let's get into the nutrient deficiency piece. If you're eating a meal, let's say you're eating pasta and chicken, you're probably not going to be getting much magnesium, and you're probably not going to be getting many B vitamins that are going to be essential. Magnesium is probably the most famous mineral for headaches and muscle cramps and things like that. And we could pull it up, but it's very easy to find in the literature the link between magnesium deficiency and headaches, and of course the muscle cramping too. So I mean, that's an easy one too from the diet perspective. It's not just the inflammation piece, it's the absence of the nutrition that you need to help, fuel these pathways. And then also, what about like fatty acids? So I remember several people where all we did is give them a high dose omega-3, couple grams a day, and their headaches were gone just based on adding in some omegas.